Do you suspect maybe your thyroid isn't working right? Maybe you've gotten your test results back and aren't real sure how to understand them. How do you know if you have Hashimoto's, which is an autoimmune condition, versus low thyroid? We're going to cover those things in this video so you can understand what tests you need and then understand those test results once you have them back.
The first test we're going to talk about is thyroid stimulating hormone. On your test results, you may see it abbreviated as TSH. It's actually produced by the pituitary gland in your brain. This tells the thyroid to produce T3 and T4. So when your pituitary gland senses that T3 and T4 in the blood are going down, it's going to send a message to the thyroid gland saying, hey, we need some more of these. That's why when your thyroid isn't working well, your TSH levels may be high because it's telling your thyroid, hey, we need some more. We need produce some more. We need some more. It's not working. We need some more. So you'll see high levels of TSH. Just because your TSH level is normal, or maybe it's on the low end, that doesn't mean you're fine. If you're still symptomatic, push to get these other tests. Doctors traditionally will order the TSH only rather than ordering the full panel to check levels. And they'll say, well, it looks okay, so we don't need to order anything else. If you have symptoms, push to get the other tests also run. The next one in a full thyroid panel that you'll see is T3. This is one of the two hormones that are actually produced by the thyroid gland. And T3 is the active form. This is the form that your cells can actually use. On your lab test, you may see it as free T3 or FT3 in the results. And what that means is it's free. It's not bound up with something else so that it can be used by the cells. The next thing they'll check is T4. This is also produced by the thyroid gland, actually in more amounts than T3. So your thyroid produces more T4 than T3. T4 is the inactive form of the hormone. It has to be converted to T3, which is that active form for your body to use it. There are several places that T4 gets converted to T3. So we have to be sure that those parts of your body are also healthy so that that conversion can happen. On your lab test, you may see it as free T4 or FT4. Reverse T3 is an inactive form of T3. So your body has taken T3 and bound it up to some other molecules so that it can save it for when it really needs it. You may see this as RT3 on the lab test. Some doctors will run this, some doctors won't run it. It's good information to have because it tells us, is your body binding this up and holding on to it for some reason? The next test to get run is an iodine test. Your body needs iodine in order to make thyroid hormones. So we want to know, are you basically peeing out all of your iodine? Does your body have enough to use, or do we need to supplement that some more? This is tested through a 24-hour urine collection. I know that makes you excited to collect your urine for 24 hours, and there's nothing like having a jug of urine in the refrigerator, but it is important to do. Personally, I don't like to supplement iodine without having the testing done, and most doctors will not do the supplementation without doing the testing. Your doctor may run the TSH, T3, T4, and potentially the reverse T3 first before running the iodine. But if your levels are low, if your T3 and T4 levels are low, it would be worth getting your iodine levels checked so that you know, does your body have this critical molecule that it needs in order to actually make those hormones. Hashimoto's or hypothyroid. Both of these cause low thyroid hormones to be produced. However, Hashimoto's is an autoimmune disease. Your body is actually producing antibodies that are attacking the thyroid and making it produce less of the thyroid hormones. Versus hypothyroid is when your thyroid isn't producing enough T3 or T4, or maybe your body can't convert the T4 to T3, or for some reason your cells aren't using the T3. This, again, is a complex process, and it can be a little hard to diagnose and figure out what's going on or what's the root cause behind why you're hypothyroid. If you're Hashimoto's or you're testing for Hashimoto's, and I actually encourage my patients to ask their doctors for these tests if they're getting tested for the first time. They actually test and look for the antibodies that are attacking the thyroid gland. And the two tests you want to have are TPO-AB and TG-AB, and the AB is antibodies. So these are two different antibodies that we're looking for. If the TPO-AB is positive, then that means that yes, you definitely have Hashimoto's. However, if you don't have other symptoms going on yet, that it may be kind of waiting in the background, and if you take action, you may be able to avoid developing it. What's normal for the lab values? Different labs have different normal ranges, and one of the things to keep in mind is that those normal values are based on a bell curve. Maybe your results are at one end or the other. For example, when I was first tested, my TSH was high, but it was within the range. Well, I finally found a doctor who said, yeah, your levels technically are normal, but you're so symptomatic that tells me that you're hypothyroid. And then we started working on thyroid supplementation. Ideally, your results for all of the testing should be close to the middle of the range. But remember, it comes back to if your results are normal, but you're still symptomatic, you need to work with your doctor to find an appropriate treatment. Perhaps maybe it's not your thyroid, but your adrenals that are causing the problem. And I have a video on adrenals that you can also watch as well. How do you talk to your doctor? Before your appointment, if you've had the test run, you want to review your test results. If you don't have them, call your doctor or log on to the portal and get those test results and review them. Take a few minutes and write down your concerns. Be sure and document your symptoms again and write down your questions. Then during your appointment, take your notes with you. If you have gotten your lab results and have made notes on them, take them with you. Again, have an open and honest discussion with your doctor. You should be able to talk through your symptoms, your questions, and your concerns. Doctors are really short on time, particularly if they're taking insurance. They may have somewhere between 6 to 12 minutes to spend with you. So this is why going in prepared with your notes, your questions, your concerns, and your symptoms helps make the process run much more efficiently. So being able to talk to them and really have that open, honest discussion is important. If they only ran the TSH, and depending on where the results are, again, explain your symptoms and your concerns and ask them to run a full thyroid panel, including the antibodies. One thing to be aware of with the antibody tests is that some insurances won't cover them, and that's just something to be aware of. You may want to call your insurance ahead of time and ask them whether or not it's covered. So that's the basics about thyroid testing. If you have questions, you can go to my website, drpennywilson.com, and set up an Ask Penny session, or you can complete the information to work with me.